Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Middle year, let's look at the microbiology associated. So there are two conditions, ASOM and the CSOM as we know. So let's look at the aerobic organisms. So first, the ASOM. So aerobic organisms in the ASOM, it includes a Streptococcus pneumonia. So ASOM, it includes the Streptococcus pneumonia. Next is the H influenza. Then comes the M catarrhalis. Next is the Streptococcus pyogenes and the Staph aureus. So there is a Streptococcus pyogenes as well as the Staph aureus. So when you look at the maximum, it is all in decreasing order. So the maximum is seen in Streptococcus pneumonia. And then comes the Pseudomonas aeruginosa. Last is the Pseudomonas aeruginosa. So this was about the aerobic organisms in the ASOM. Now let's move on to the CSOM. In terms of CSOM, chronic separated otitis media, the aerobic, it includes mixed growth. So there is mixed growth in terms of the CSOM. Then comes the aerobic organism. There includes the Pseudomonas aeruginosa. So Pseudomonas aeruginosa. Next is the Proteus, E. coli, as well as the Staph aureus. So in CSOM aerobic organisms, there is mixed growth, there is Pseudomonas aeruginosa, there is Proteus, as well as E. coli and Staph aureus. So important is there are two P's. There is Pseudomonas aeruginosa as well as the Proteus. Now, another significant finding will be the anaerobic in terms of the CSOM. So here in CSOM, what are the anaerobic organisms? So this includes the Bacteroides fragilis. So there is Bacteroides fragilis. And in CSOM, there is also the anaerobic streptococci. So anaerobic streptococci. To learn and grow daily like this, please do subscribe.